Yeah, it's coming a live video. Yeah. It's on live video mode. Mm-hmm. Vijay Kumar, good evening, madam. Is coming. Mm. Surya from good evening, doctor. I can see everything. Okay. Sure. Yeah, fine. Hello, good evening to all. I'm on Facebook Live. I'm Dr. Asha Mahilmaran, interventional cardiologist at Apollo Hospitals. I'm going to be talking today about the current scenario of COVID and what impact it has on acute cardiovascular diseases, especially heart attack. What is happening to our heart attack patients and how to handle in this new era of COVID. COVID has stopped the world in its stride. It is a pandemic involving more than 200 countries. More than 4.5 million people are afflicted as of today. It has produced more than 3 lakh deaths. In India, there are more than 85,000 people affected by this disease. There are more than 2,700 deaths happened in India as well, with a case fatality rate of about 3.5%. It's very important to know that COVID is here to stay for the next few months or maybe a year or two, we don't know, or it may go this year and then come back after 1 year or yearly, like we have the swine flu, influenza. So we need to wait it out till we have a definitive treatment for COVID or we have a vaccine developed. So until then, we cannot paralyze our lives. Lives need to go on, and we need to handle the other important health conditions as well. We cannot close a blind eye towards other health problems which are there. What has been noted all over the world, and this was first reported in China, that there is a reduction in the admission rates of acute myocardial infarction. There's a paper from Hong Kong which says nearly 40% reduction in the admissions for STEMI. STEMI is the medical terminology for the general heart attack. STEMI is called as ST elevation myocardial infarction. There are two types of heart attack. You have STEMI, what is ST elevation myocardial infarction, and non-STEMI. There is no ST elevation on the ECG. It presents as chest pain, which can be smoldering, and it is also a form of heart attack. So there are two major types of heart attack. One is due to a total occlusion of a blood vessel to the heart, called the coronary artery. It is 100% occlusion, results in a STEMI, and here the muscle damage happens if the patient does not reach the hospital on time and the vessel is not opened either by a primary angioplasty or by a Lytic Therapy. The muscle is permanently damaged, and this will lead on to further complications and even death. In non-STEMI, there is a non-occlusive block, which may be 80% or 90%. Some patients with non-STEMI will have a very severe form of this disease. They can have pulmonary edema, they can have breathing difficulties, they can have arrhythmias, heartbeat irregularities, and a high mortality as well. There can be less severe forms of non-STEMI, which present as chest pain, which keeps on and on recurrently happening in the rest or on minimal exertion. And these patients are called as low to intermediate risk, and these patients can be stabilized medically and then taken up for an angiogram after 24 hours. So these are the two types of myocardial infarction. Not only in Hong Kong, Spain has reported a drop of about 60%. USA has reported a drop of STEMI by 60 to 70%. And in India, in our own center, what we have analyzed was In March, we had the same number of myocardial infarction admissions as in January and February. But in April and May till date, there is a drop by 50 to 60%. And this has been noted in all the other countries, including UK. And non-STEMI has been virtually come to very minimal amounts in all the countries. And there are two perspectives to this problem. One is, it is impossible for cardiovascular disease to go away because of COVID. Cardiovascular disease is a chronic condition, and patients with risk factors like diabetes, hypertension, smoking, dyslipidemia, they have blocks which have developed over the years, and this cannot go away within 2 or 3 months. What is happening is a heart attack occurs due to specific triggers which result in a plaque rupture. And these triggers are what probably are not happening now or happening to a lesser extent. These triggers are social stressors, job-related stresses, stress of being caught in a traffic, air pollution, unhealthy eating habits, unhealthy smoking habits, and binge drinking, all of which have reduced now with more relaxed atmosphere. There is not much of job stress. Air pollution has come down to by 30%. All of this probably has reduced the triggers. But this is not a scenario which is going to be permanently present. And when we come back out of the lockdown, we will be exposed to the same triggers again. And so there can be a rebound or an increase in the incidence of myocardial infarction subsequently. So we need to be equipped, knowledgeable, how to handle it. And the other perspective, why patients with STEMI or non-STEMI are not reaching hospitals are probably because people are scared of the coronavirus and they're not reporting to the hospital on time. In Hong Kong, they have published a paper that normally patients with STEMI report within 80 minutes, that is less than 1.5 hours, whereas now their reporting time is close to 300 minutes. And this is not a healthy scenario, because the more delay, the more muscle damage will occur and the more incidence of mortality or death will occur in a STEMI. We have what is called as a golden hour. Patients should reach the hospital within the first 60 minutes when the results of intervention are best for patients with STEMI. And this time is muscle and time is life as far as STEMI is concerned. So undue delay because of the coronavirus situation is definitely not advisable. And some of the patients are probably not reaching hospital at all, and they could be dying at home, or they could be left out with significant muscle damage, and they will be coming back to us later on with heart failure. Heart failure is a serious issue with mortality or death of 50% over 5 years, which is even worse than cancer. So all in all, STEMI should not be neglected. If there is a significant chest pain radiating to the left arm, to the back, to the jaw, right side of the chest or right arm, it can be present in any of these regions. Sometimes patients can only present with left arm pain or jaw pain or a right shoulder pain or back pain. So any unusual symptom presenting for the first time, which is lasting more than 15 minutes, which is not going away and is associated with sweating, breathing difficulty, or maybe giddiness, nausea, vomiting, all these symptoms should not be ignored. And what is the best way to get yourself to the hospital in this COVID scenario is, with lockdown, transport is not freely available, but ambulance services are still available all over India and the world. So the best thing is you call the emergency services, call the ambulance, and transport yourself by ambulance to a tertiary care center where you will be triaged in the emergency room by doing an ECG. The ECG will tell whether there are ECG changes of STEMI or non-STEMI. Then you'll be subjected to a blood test which is called as a troponin. If the troponin is positive, and the amount of positivity also determines the prognosis. If it's a very much raised, it means it's a large MI, and you will be subjected to an echocardiogram which will tell whether the heart muscle is damaged, whether there is any regional wall motion abnormality. If at least there are ECG changes, there are troponins are positive, the echo is showing some changes, 2 out of 3 is positive, then the indicator that you need to have a further evaluation and treatment immediately. There are 2 options. One is going for an angiogram and a primary angioplasty in centers wherever it is available. That is the best option. The block will be opened up, and then there'll be a stenting called as angioplasty. This is the best solution to save the heart. The next best is in centers where there are no facilities to perform a primary angioplasty. You could be given a Lytic therapy, which is a thrombus buster therapy, which is given through the intravenous route, and this will act instantaneously, and the block will be, the blood clot over the block will be dissolved. But this is not a standalone therapy. This needs to be followed within the next 24 hours by a coronary angiogram and an angioplasty. And medications for blood thinners, statins will all be, the lipid lowering therapies will be initiated, and then you will be free to go home after 2 or 3 days in a stable scenario. In an unstable scenario, it may take a longer time. So it is very important, if there are heart attack symptoms, not to delay it. Non-STEMI, which is a non-occlusive block, should also not be ignored. Even though the chest pain may be tolerable, it may not be very severe, but it is persistent and it will keep recurring. If ignored, non-STEMI, even in an intermediate risk patient, may subside for the time being, but later on, in up to 30% of patients, it will be followed up with a major MI or even death within the next 3 months. So it is important not to ignore a non-STEMI scenario as well. Now coming to how to manage or prevent a COVID disease in a person with a known cardiovascular disease or risk factors for cardiovascular disease like diabetes, hypertension. It has been noted that compared to the general public, diabetes, hypertension, and known cardiovascular disease have a higher risk when they develop a COVID infection. The mortality in the general public is 3.5% overall, but if they have a cardiovascular disease, it can go up to 10%. So it is very important to prevent, first of all, a COVID infection. People with cardiovascular disease should be more careful in avoiding crowded areas, maintaining social distancing, wearing masks whenever they go out, and using hand sanitizer or soap solution to wash themselves whenever they go out, touch other surfaces. It is very important. These 3 are very, very important. Social distancing, use of frequent soap, and use of mask can definitely protect you from getting an infection from another person. And avoidance of the number of times you go out of the house. You can walk on your terrace. You don't have to give up on your exercise. You should not be going out very frequently, and definitely avoid crowded queues. Go at times which are thinner in terms of number of people standing in queue for buying something. If there is a younger person who does not have the risk factors for cardiovascular disease, they could be the ones to go out and buy the grocery or the fruits and vegetables, or you can call in food and vegetable delivery home, or buy from your local vendors who are going on the carts in the streets. So use all means to minimize the risk factors and exposure to people with COVID infection. And the other important thing is control your blood pressure, your blood sugars, and continue to take your cardiovascular medications. There has been some confusion about use of ACE inhibitors or ARBs in hypertensive patients because it has been shown that the COVID virus, if you see the diagrams, there are certain spikes on the surface. These are called as the S spikes, and then means of entry into the cell is to the ACE2 enzyme. And since the ACE inhibitor and ARB are blocking this ACE enzyme, and there is an increase in ACE2, there has been some doubt whether patients who are taking these drugs will have an increased risk of COVID infection. In a large-scale study of more than 18,000 patients from the US, it has been shown that there is no difference between the patients getting infected with COVID, whether they are on ACE inhibitor therapy, ARB therapy, or otherwise. And all the world bodies, the guidelines by American College of Cardiology, Indian hypertension guidelines, the European Society of Cardiology, the UK have all unanimously said it is safe to continue your antihypertensive therapy as before. So do not stop for any reason the antihypertensive therapy or the cardiac medications which you're already on. And this is very, very important. And next comes, if there is a COVID disease, sometimes they develop an increased cardiovascular complications. COVID per se can result in cardiovascular complications. It not only produces lung injury, it can produce acute myocardial injury. This is due to several reasons, and we'll see some of the reasons. It could be because of a direct myocardial injury by the COVID virus, because the ACE2 gene is present widely in the lungs, in the heart, as well as in the intestines. So the injury to the heart can happen through the ACE2 genes which are expressed in the heart. So there can be a direct myocarditis or pericarditis. There is a covering around the heart can be involved. The myocardium, the muscle of the heart, can be involved and result in weakening of the heart, and presenting heart failure can occur. The patients can have, because of the stress of the COVID infection, they could have a plaque rupture in previously patients with cardiovascular disease, and this can present as a STEMI or a non-STEMI in a COVID infection as well. In COVID infection, it's also known that there is widespread inflammation and there is a lot of cytokine release. Cytokines are the mediators of inflammation. And this inflammatory scenario can result in a damage to the heart. And this is called as a cytokine storm. It can produce not only damage to the heart, it can produce damage to the kidney, to the liver, and to the lungs as well. And there is a type 2 MI can occur. What is a type 2 MI is what we generally see, what is called a STEMI or non-STEMI is a type 1 MI. And type 2 MI is a supply-demand mismatch, which means that because of the decreased oxygen levels, because of the widespread lung damage, there can be delivery of oxygen to the heart, there can be low blood pressure, hypotension, and this can result in a scenario of ECG changes and myocardial damage, which is called as a type 2 MI. What is important to know is in a type 2 MI, you should not be giving thrombolysis or doing an angiogram or primary angioplasty. Here, primarily what is required is stabilizing the blood pressure with inotropes, supporting the lungs with oxygen therapy or ventilation therapy is more important rather than rushing into the cath lab and doing an angiogram and exposing the healthcare workers as well to the risk of COVID infection. So COVID can present as a mimic of STEMI. It's called as a STEMI mimic, has been known to occur in COVID infection. And this can be deciphered after the testing for the COVID, and then for other parameters like the CRP, D-dimer, and other biomarker levels will be assessed, and this will be diagnosed as whether it is due to a cytokine storm or it's basically a STEMI occurring in a COVID patient. There can be also interactions with the antiviral drugs. The hydroxychloroquine, which is commonly used for COVID infection, can produce certain arrhythmias in the heart in patients who are prone for it. So it should not be just like that given to all patients, and patients with known cardiovascular disease should have an ECG before they are prescribed hydroxychloroquine, where they will be looking at certain parameters like QT interval, and if it is prolonged, these patients should not be given a hydroxychloroquine, and hydroxychloroquine and azithromycin combination is more dangerous. So do not take over-the-counter medications without consulting a fever clinic. There are designated fever clinics available now by the government order, and all patients with fever will go through these fever clinics where they are triaged as whether they are got COVID symptoms or they are non-COVID etiology of fever. All those with non-COVID etiology of fever would go to the general pool of hospital care, and those with COVID will go into a COVID isolation ward. So this is triage in fever clinics which are situated at the entry of the hospital itself. So people who are coming into the ER for cardiac problems need not be worried that they will be clubbed with COVID patients sitting next to them or lying down next to them. They are streamlined at entry itself, and then they are sent to designated isolation wards. So all the hospitals are equipped to handle this, and only which hospitals which are equipped to handle this accept the fever patients. So there is no need to for undue fear for patients with other emergencies like STEMI to have a fear of entering into the hospital. And in the hospital also there are sanitization procedures followed. There are PPE for the healthcare workers. At the entry itself, both the patients attenders are given masks, they are given sanitizer to clean their hands at the point of entry itself. So this undue fear of coming into the hospital for emergencies need not be present. Having said that, people with chronic diseases like hypertension, diabetes, the best thing to do now is if they are already on a treatment algorithm, to follow the same and keep checking themselves by home BP monitoring, home glucose monitoring, and teleconsultation services are now widely available, and you could use these teleconsultation services to interact with your doctor for adjustment of your medications based on your blood pressure and sugar values or lipid values. This could be easily done. If you have any symptoms which warrant physical confrontation, only then you need to go to the hospital. So by minimizing the load on the hospitals, you can also prevent too much of overcrowding in the hospitals, and thereby social distancing is maintained in the hospitals also. So by following certain basic principles and understanding how to go about in this post-COVID era, I'm sure we can all fight the COVID without the collateral damage of missing STEMI or non-STEMI. Essential cardiac emergencies should not be missed in this period. There should not be any delay. What we have already learned and mastered in handling the STEMI and non-STEMI is through prompt entry into the ER and triaging into high risk, intermediate risk or low risk, and all the high risk and intermediate risk should go into the cath lab or get appropriate therapy. If this is not happening, then the collateral damage to COVID infection, there'll be much more deaths due to the other diseases other than COVID as well. And this should not be allowed to happen. When we are concentrating and trying to minimize or mitigate the impact of COVID, we should not allow the death rate from other important essential diseases for which we have proven therapies and which we know very well how to handle should not be missed out. And that is the most important message for today. What is very important is not to miss reaching the hospital on time. Ambulance services and the emergency services are available in all the hospitals. So please use the emergency services, use the ambulances more liberally to get you to the hospital if you have chest pain. And do not miss out on STEMI or non-STEMI. And any delay in diagnosis and any delay of presentation will result in high mortality and further risk to the patients.